The British government's been accused of sleepwalking into a second surge of coronavirus. If so, this was the alarm call. Dispassionate data delivered by the UK's chief medical and scientific officers showing a doubling of infections every week.
So let's say that there were 5,000 today, it would be 10,000 next week, 20,000 the week after, 40,000 the week after. And you can see that by mid-October, if that continued, you would end up with something like 50,000 cases in the middle of October per day.
And more infections mean the likelihood of more deaths. Urgent action is needed. Elsewhere in Europe, Spain's ruled out a second national lockdown, favouring partial restrictions where contagion levels are highest. In the capital, Madrid, police checkpoints are back. The city's poorest areas are suffering the most, a blow for businesses already on the breadline. In the Czech Republic, a surge in cases has cost the country's health minister his job. Restrictions lifted months ago are now likely to return. France, Greece and Denmark have also imposed measures in virus hotspots, while health authorities in Italy say the average age of patients is creeping up, risking more deaths. Governments across Europe are wrestling with a worsening health emergency, an ongoing economic crisis. Leaders are having to walk a very challenging fine line between controlling COVID-19 and inadvertently fueling unemployment and poverty. Britain is now at the same tipping point. More than 13 million people are already facing restrictions and curfews in the north of England and the Midlands. The capital could be next. In the absence of a vaccine, and while testing remains inadequate because of a shortage of laboratory capacity, there are very few options and little time to lose. Neave, Al Jazeera, London.